Hi, I'm Colleen O'Neill, the Integrative Medicine Program Manager at Roswell Park Comprehensive Cancer Center. I work in the pediatric unit providing care to patients and their families to support them during their treatments at Roswell Park. I completed my master's training at the New England School of Acupuncture, which is now part of the Massachusetts College of Pharmacy and Health Science. My doctoral work was at Pacific College of Health and Science. I was fortunate enough to choose a school that allowed me to specialize in gentle Japanese styles of acupuncture, including non-insertive styles where needles are not even placed into the body. I've been able to continue my studies in both Japan and China, including a clinical internship at the Zhejiang Provincial Hospital of Traditional Chinese Medicine in the People's Republic of China. I have an industrial engineering degree and a psychology degree, but I couldn't decide what I wanted to be when I grew up, so I also became an emergency medical technician and volunteered on ambulance squads. At the same time, I was having horrible migraine headaches. I don't do well with pain medicine, and I was allergic to Imitrex with a really strong reaction. I was desperate, and as I told my friends, I resorted to acupuncture for relief. It was amazing, and not only did it help my migraines, but I don't even get headaches anymore, and I had to learn more about this. So I began my exploration of acupuncture and East Asian medicine in 1995. At that point, people weren't even aware of this modality, and when I said I was going to study acupuncture, they take a step back like I was going to take out voodoo darts and start stabbing them. My grandmother even used to ask me, "Can't you become a real doctor?" But then she started suffering from trigeminal neuralgia, and after I treated her, the symptoms went away. After that, she started telling strangers in the grocery store about acupuncture and how amazing it is. Luckily now, people are much more aware of how integrative medicine can be used alongside Western medicine. Not everyone is going to believe, and that's okay. I've been able to help many skeptics feel better too, so you have nothing to lose by trying integrative medicine. The interesting thing for me is that I still use all my education. Industrial engineering taught me to help companies work efficiently, and now I help people's bodies work efficiently. Psychology helps with every interaction with others, and the EMT work began to prepare me to be part of patients' medical care team. I love to learn, and I keep working on new skills to help my patients. The amazing thing to me is that integrative medicine is not an either-or type of modality. So there's no concern about adding integrative medicine techniques to typical standards of care. Chemotherapy, radiation, infusions, they all can negatively impact the body, basically beating the person up. Many of our patients are suffering from anxiety, chemo-induced peripheral neuropathy, nausea, vomiting, extreme fatigue, or pain symptoms, just to name a few. Integrative medicine can help to support the body so it can better tolerate the typical standards of care. Sometimes neutropenia can occur where neutrophils become such that doctors say, "Oh, it's not safe to do another round of chemo this week because your immune system is just too weak. We need to let your counts recover first." Acupuncture can prevent this from happening or at least reduce the frequency of those occurrences. Acupuncture has been around for 2,000 to 5,000 years, depending upon what source you use. But what's really exciting now is that the fact we have the ability to utilize modern technology to validate that acupuncture really does work. For example, there are functional MRI studies that take an image of the brain, then they needle an acupuncture point and then rescan it, and you can see that the brain is operating and firing differently, just as a result of that acupuncture insertion. I've worked with cancer patients for many more years than I'd like to admit in my private practice. And when the opportunity came about to join Roswell Park, especially to work with pediatric patients, I jumped at it. Working with children can change their quality of life and their entire family's quality of life. For me, to be a part of that story makes me really excited. And I'm thrilled to be a part of the amazing care team at Roswell Park. Every single person I've come to work with is completely dedicated to their patients. The Pediatric Hematology and Oncology Department is part of a joint venture with Oshai Children's Hospital, which really helps to keep the focus on patient continuity of care, even when they need to be inpatient. At Roswell Park, you get cutting-edge research, compassionate providers at a facility that recognizes you as a complete person. Plus, you get me, an integrative medicine. But seriously, I love helping people feel better, empowering to do what they can do to help themselves, and ultimately improve their quality of life. What drew me to acupuncture is that it's both an art and a science. There's very specific points that have specific functions, locations, and depths of insertions. But then there's the art as to which points to utilize to address the patient's complete picture. Different acupuncturists are going to utilize different points, and even the same practitioner will use different points for patients coming in for the same complaint because the other symptoms of the patient also needs to be addressed. Acupuncture is the technique of stimulating specific points along the body, and I can utilize various tools to activate these points. I can use needles, magnets, Shonishin tools, or even just my finger as an acupressure. Now, Shonishin is a pediatric style of acupuncture where a tool is rubbed, tapped, or pressed along the points. And children actually really enjoy the treatments, and many have referred to it as a tickle treatment. And there's many other styles of acupuncture as well. When you see acupuncture in the media, there's often an image of many points being needled on the face. That's not typical. In fact, acupuncture style that I like to utilize incorporate minimal points with very shallow insertions. It's not something to be afraid of, and it's actually very relaxing, and many people fall asleep during a session. Reiki is another modality that we use at Roswell Park, and it's an energy medicine that utilizes just the hands as a tool. Patients often feel a sense of warmth and relaxation, and it's wonderful for stress reduction and helping the body. I'm also able to utilize massage, meditation, breathing techniques, as well as some movement techniques through Qigong. And I'm currently completing an integrative aromatherapy program to be able to offer the benefits of essential oils to patients soon. Ultimately, it's my patients that make me look forward to coming to work. I love their smiles, their strength, their perseverance, and I love that they allow me to be a part of their story.